Welcome back. This section of the show is called Ask FPA. You can send your medical questions to tv@fpalex.com and include your name if you would like us to use it on the air. The question tonight is, can I get the flu from the flu shot? Asked by Sue Sims of Versailles, Kentucky. And our guest here to answer it is our newest nurse practitioner at Family Practice Associate, Miss Whitney Adams. Welcome.
Thank you.
All right. Who should get the flu shot?
Well, the CDC recommends actually that all persons that are age 6 months and older get the flu vaccine every year. There are certain high-risk populations that we need to make sure always get the flu vaccine, and those are patients that are considered over the age of 65, less than the age of 2, pregnant ladies, or certainly those that have chronic health conditions like COPD or asthma or diabetes, or someone who might be immunocompromised.
Now, you can't get the flu from the flu shot.
No, that's a long misconceived notion that you actually cannot get the flu from the flu shot. It's an inactive virus, so though folks might mount a little bit of a response to it, meaning they might get some soreness in their arm, they might have a low-grade fever, you cannot get the flu from the flu shot.
Now, are there different kinds of flu shots?
There are different kinds of flu shots. There's a trivalent flu shot, a quadrivalent flu shot. That just refers to the number of strains of the vaccine that a patient might be protected from. And then there's a high dose, and again, that kind of is just a higher dose of either the trivalent or quadrivalent, meant to address populations that we talked about that were considered high risk before. Those folks over the age of 65, people with other chronic health conditions.
And they pretty much, all the shots give pretty good protection for the flu.
They do. All of the shots this year do give pretty good protection against the flu. The one thing that's not available this year, speaking of protection, is the flu mist. Based on recommendations from the CDC, there's less than expected efficacy over the last few years with the flu mist, so they've actually recommended that patients not receive that from either their pharmacy or from their doctor's office this year.
The flu mist was the injection.
Yes, that was the nasal.
The liquid up the nose, what all the kids liked, because they didn't have to get a shot.
Correct.
But now it's not available.
Finding that it's just not nearly as effective as the traditional flu vaccine is.
Now, you mentioned some high risk things like asthma,
chronic lung conditions, COPD, folks with heart disease, people who are immunocompromised, and certainly the elderly population, those over the age of 65, are considered high risk that might qualify for use of the higher dose flu vaccine.
Now, the flu's bad enough. You ache, high fever, feel bad, lose work, but it can also kill you.
Right. Again, that's the importance of everybody getting their flu vaccine, especially those folks that might be at greater risk for complications related to being infected with the flu, that high-risk population, because it can be a really serious illness for that population.
So what kind of complications the flu
You can get pneumonia. You can develop other problems, serious respiratory infections. You can really end up with a serious health complication if you have flu that's related to your not being inoculated early on. So if you think you're getting the flu, do you need to see your doctor right away? Do you need to wait a week? I mean, how do you know? That's a good question, and a lot of people are really confused by that. Again, the flu's a virus, so there are several things that you can do to try to mitigate some of the problems with the flu. Specifically, those high-risk patient populations that we talked about with chronic health conditions, people that are elderly are really at risk for developing complications. They should really go see their doctor as soon as they develop symptoms. The good part about that is that if you go within the first 1 to 2 days after you develop symptoms, oftentimes we can prescribe antivirals that can help not only shorten the duration but also lessen how severe your symptoms are. The general average population should expect that they may have some symptoms that they can generally manage at home for a few days to a couple of weeks, and though it's not comfortable, they're not nearly as at high risk of developing complications as some of the folks that we see with chronic health conditions. Certainly sooner is better if you think that you might qualify for some of the antiviral treatments that could be prescribed for you.
And wash your hands and don't share it with your neighbor.
Absolutely. That's the single best way of preventing the spread of the flu vaccine. It's spread from person-to-person contact. But additionally, remember that anything that the person touches, the virus can live on surfaces as well. So the computer mouse that you're touching, the door handle, magazines, anything, the virus can also be spread and shared that way. So hand washing is going to be the single most important way that you can mitigate the spread of the disease. If you don't have access to soap and water, then just an alcohol-based hand sanitizer should do well as well.
Great information. Thank you for coming in.